name is Rachel Sherman. I am a nurse practitioner with Chesapeake Supportive Care, a subsidiary of Hospice of the Chesapeake. So today I'm joined by Dr. Eric Bush, who has the privilege of serving as the Chief Medical Officer for Hospice of the Chesapeake and Chesapeake Supportive Care. Dr. Bush does a lot for our patients as well as those in our community. He really enjoys working at Hospice of the Chesapeake and helping patients with making end-of-life decisions and that transition. And as the COVID-19 pandemic continues to impact our area, Dr. Bush and as well as several other community leaders have recognized that it's important to discuss how racial and ethnic minorities are being affected by this very devastating disease. We're also joined by Reverend Dr. Henry Davis, who is the pastor of First Baptist Church of Highland Park. He's been pastoring there since 2000 and leads an active membership of over 3,000 disciples who engage in more than 80 ministries. Dr. Davis studied at Oral Roberts University and earned his Doctor of Ministry from the United Theological Seminary. We are also joined by Rabbi Steve Weisman, who has served as the spiritual leader of Temple Solel of Bowie since August 2000. He was ordained in 1991 by the Hebrew Union College Jewish Institution of Religions, New York School, and previously served congregations of Virginia and Connecticut. Rabbi Weisman has a strong background in interfaith and community work, including working as a volunteer pastor at Mount Washington Hospital and Hospice of Rappahannock. So, Dr. Bush, I'll hand it over to you if you could open up with 2 minutes about how COVID-19 has impacted you.
Great. Thank you so much. So first, I'd just like to say thank you to Dr. Davis and Rabbi Weisman for being here with us today. We've had prior conversations regarding impact of faith and how that impacts on patients and families coping at end of life. And this time we're here today to address more COVID-19. Unfortunately, COVID-19 has impacted disproportionately on communities of color and other ethnicities in this country to a degree that is overly burdensome. And so I think that faith helps people cope. It gives them a context to put things in. It helps them try to be as resilient as they can. I'd like to address, first off, some of the misconceptions regarding the vaccine. So first is, that this was rushed and that it's new technology, that the effectiveness and safety of the vaccine cannot be trusted. The technology that's used, the mRNA technology, has actually been in existence for about 20 years. Multiple reasons why this happened so quickly is, again, because it is technology that has been around. Coronaviruses, given their prevalence, how ubiquitous they are one of the most studied viruses known to humankind. China, I know there's been a lot of criticism of China, but actually China isolated and shared genetic information about COVID-19 promptly, and this helped scientists start working on vaccines quickly. No steps were skipped in the testing. The tests were done very well. A fair number of minority and people of color were included in the testing, including those of multiple ethnic backgrounds. And America is a good pool for that. I come from a history of immigrants to this country, and so it's good. It gives you a good, varied genetic mix to test these vaccines on. In addition, this was really a universal effort. No resources were spared, and so that helped. Everybody was actually on the same page, at least regarding vaccination. Masking and all that, that's a different story. But from a vaccine perspective, developing a tool, really having that cohesiveness and so many people getting to work right away really helped the vaccine come to fruition quickly. Another myth is that the vaccine can make you sick with COVID-19. This is actually not possible. That is one of the benefits of this mRNA technology. It is not a whole killed or attenuated virus. so to speak, as some of the older vaccines are. And so hence, it's actually theoretically impossible that it could give you COVID-19. Another myth is that the side effects are dangerous. While side effects can be, flu-like to some degree, some body aches, some headaches, a fever, they generally last about a day or two. And things, that people have had before with other vaccines, such as Bell's palsy, are extremely rare. The incidence with either one of the available COVID-19 vaccines is actually 1 in 10,000. So it's really few and far between. And again, there's concern there that there may be something in the vaccines that's going to help track you or whatever, and that's just not true. That is not possible. The other concern, there's a couple other things I just want to address real quick, is that once you've had the vaccine, you no longer need to mask or social distance. Again, that is not true given some of these new emerging strains that we have, the South African strain, the Brazilian strain, that tend to be the UK strain that can replicate more quickly and be more infectious in nature. The other pieces too is just because you've been vaccinated doesn't mean that you can't carry coronavirus or be a carrier, so to speak. So again, you need to mask, social distance, good hand washing in order to make sure that you're protecting those around you. And finally, if someone has had COVID-19, if they've actually had the virus themselves, they don't need to get vaccinated. Again, that is not true. The immunity from having COVID does not last forever. Some people, unfortunately, have been able to contract it twice. The immunity is probably somewhere between 3 to 6 months from having COVID itself. The vaccine immunity is probably around a year. Again, we're finding out more about this. So again, either way, you'll likely need to get vaccinated at some point in the future, and or if you've had COVID-19, it makes sense to get vaccinated. And so I just wanted to get that out there and try to get in front of some of these myths that are propagating. And again, I understand there's a lot of info out there on the web, but please go to validated pages such as MedPage or Medscape that tend to come from validated medical sources. People get caught up in the blogosphere, and that's how rumors spread. And then unfortunately, you have some of the people that we see, the frail, the elderly that have multiple chronic medical conditions. They're frightened to get the vaccine, and then unfortunately they get COVID, and those are the ones that are at highest risk of mortality. Again, we want to protect those around us. We want to make sure they live as long and full life as possible, not to hasten or delay what God is going to do. It's going to happen naturally, and this is something that could definitely help people at this time. Thank you.
Thank you for that and for dispelling some of the myths. Pastor Davis, can you share what your experience has been with COVID, whether it's in the faith setting or even in your personal setting?
Well, both in faith and my own personal settings, it's affecting on all levels in terms of dealing with families who just the pain of losing a loved one. We've had persons within our congregation, and one of the things that I've looked at is just the death rate has gone up. And so whether we attach it to COVID or whatever, we're looking at increased deaths worldwide. And so in my position as a clergy person, it ends up, having to minister to persons. And then the other dynamic is these settings are being done virtually. So you have limited persons who are there. The whole grief process is different. Persons are connect to the service through Facebook and other cyber ways. And so those end up being some of the things that we've been kind of navigating through, and then just dealing with week-to-week worship that now the concentration is more on, the cyber world and virtual. And we probably in the course of the last year have had our largest worship assemblies. We might have 15 to 20 people. And so that's a big day for us now in terms of actual persons in the building. When you're accustomed to looking at probably pre-pandemic, maybe 2,200 people per weekend. And so so I'd say to persons, right now I'm ministering using my imagination. And I tell our congregation, I have a big imagination.
and nonetheless influential, right?
Well, and hopefully so. I've gotten the vaccine. I was able to get the vaccine last week. And of course, I posted it on our social networks, and we streamed it in our services so that persons could see the pictures. We do have a video of that event. So just trying to encourage persons, because just as Dr. Bush just mentioned, in terms of some of the myths, some of those same myths of persons have articulated to me about the tracking, don't trust it, all this, the kind of things. And so we're trying to deal with just information and trying to lead persons in what we believe to be the healthiest directions.
Absolutely. Thank you for that. And Rabbi Weisman, what have been your personal and faith effects or experiences due to COVID-19?
My experience has been very much like Dr. Davis's has been in terms of the congregation itself. We've had an uptick in deaths and in pastoral care for those suffering, which in our community has been very fortunate for us, mostly not directly our community itself, but the distant relatives and geographically distant relatives of our members. We've made the adjustment to not being surrounded by family and friends at the graveside because of the need for social distancing, and allowed ourselves to find in the space between our physical bodies God's presence as the comforting presence there. On those occasions, I share Henry's sensation of the impact of moving online for worship and for the pastoral care of the mourners. In the Jewish tradition, that first 7 days of mourning after the burial is generally done in the home, and we actually bring the worship of the community into the mourner's home, and that's a significant piece that we've lost, within the Jewish community, and for better or for worse, the technology of online gathering doesn't really serve exactly the same purpose. I don't want to say the worship is an excuse for the physical presence and consolation, but what's felt missing is the sense of the warm hugs and the person-to-person conversation that are so much harder to recreate online. I have not been vaccinated yet. I pre-registered before clergy were bumped up to 1C. And apparently, even though I updated my pre-registration, I'm not getting the same connection to people who know where and when to make arrangements to get vaccinated that many of my colleagues are and many of my congregants are. It's a little bit concerning and frustrating. Honestly, I'm not sweating it a lot. I'm comfortable that it means more of my congregants right now who may need it a little bit more urgently than I do are getting it. As long as we're able to stay in this mostly online version, my priority in my own mind is a little lower, but I will be much happier when I know that I am vaccinated as well, to allow me a little more freedom and a little more comfortable in being a little bit more personable and in person with my folks when they need it. We haven't really been hearing the myths. My folks have generally been going about trying to get their vaccinations. Some of my older folks having difficulty navigating the online process of what you have to go through to get registered. But by and large, we're finding ways to help those who need the help to get it. And slowly but surely, we're getting ourselves vaccinated. For us, most of our folks have been incredibly patient and comfortable in this great new online. I resonate, Dr. Davis, with what you said in terms of, the actual turnout. We haven't had actual to turn out for 11 months now. our Friday nights are a very different reality. We're reaching a lot more people online than we were in real time. And we're reaching much further geographically. We're actually finding that relatives are joining us, old friends of mine are hopping in and sharing the world. People who moved away from the community physically are tuning back in because they know we're there. And the other great shift besides geography has been a time shift. Besides changing the time of our worship, for the Sabbath to an earlier time to allow folks to go from our worship to their Sabbath meal at their dinner table. What we're finding is those who can't join us at 6 o'clock on Friday night are looking for us at other times when they can join in the worship and gain what they can gain from it on their own. And that's a new reality that I think we're all going to have to deal with, whether we're in the religion business or the medical business, when we come out the other end of this in terms of how we provide the services that we provide. And I think there'll be a lot of positives coming out of that aspect of it for us.